the external auditory meatus, the glenohumeral joint, the greater trochanter of the femur, the lateral condyle of the femur, the lateral malleolus of the ankle. They should be stacked up one on top of each other. Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I've got another book review for you guys, and today I'm going to be reviewing the book Muscles, Testing and Function from Florence Kendall. In my 18 years as a coach, this is easily one of the best books that I have read, and if you are either a therapist or a strength coach who treats patients or clients with postural dysfunction or pain, or if you yourself have postural dysfunction or pain, I would highly encourage you to pick up a copy of this book. Now we're going to get into what exactly you could find inside, but first real quick, like the video and comment down in the comment section, as it would really help me out and help with the algorithm. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel, hit the notification bell so you don't miss out on any of the content. Now, let's take a look at what is exactly inside. There's a lot of information in here, so I'm not going to be able to go over everything, but I'm going to go over some of the key points. One of the things that you're going to find in this book is it's going to go over the different joint motions. With regard to the joint motions, first thing is going to be the different types of joints. We have three broad classification of joints, and that is going to be fibrous, cartilaginous, and synovial. With regard to fibrous joints, these are going to be joints that have very, very little and limited, almost no range of motion at all or no movement. With regard to cartilaginous joints, these are going to have a little bit of movement. And then with regard to synovial joints, these are going to be freely movable joints. And then within those broad categories, we have a lot more different distinctions. We have things like ball and socket joints, hinge joints, condyloid joints. So that's all going to be covered in this book over here. Another thing with regard to the joints is it's going to go over the different anatomical positions, the axes, and the planes of motion. With regard to the planes of motion and the axes, we basically have the transverse plane, the coronal or the frontal plane, and the sagittal plane. The sagittal plane, it separates the right from the left side of the body. The coronal or frontal plane is going to separate the front from the back of the body, and the transverse plane is going to separate the top from the lower portion of the body. So your sagittal plane, that is going to be things like when you're doing movement, pushing and pulling. Your frontal plane or coronal plane, that's going to be your side-to-side bending, and then your transverse plane is going to be things like your twisting. Then, aside from that, another thing is going to be the different types of movements with regard to the joints. So you have things like flexion, extension, medial rotation, lateral flexion. All of those different types of movements are going to be covered in this book. Another thing that's going to be covered in the book is the muscle length tests and stretching exercises. And if you are interested in learning how to assess properly, I actually have an assessment series playlist with 107 videos on how to assess. You can check it out right up over here. But one of the things that is going to be in this book is measuring joint motion, and it's going to go over some equipment that you're going to need. Two of the most important pieces of equipment in this book are going to be a goniometer and a table. For a lot of assessments, you are going to need to put the patient on a table, and the goniometer is going to be really, really good if you are measuring individual joint actions. If you are measuring more gross actions, so let's say you're doing something like a Thomas test, then you're not really going to need the goniometer. That's more of a visual. But for the little small joints and all of the different joints in the body, you are going to need a goniometer, or at least it would be very, very beneficial. Another thing that's going to be covered in this book is going to be posture, and specifically alignment and muscle balance. And if you are interested in learning how to perform a postural assessment, I actually have a video on how to perform a postural assessment, which you can check out right up over here. But one of the things that's going to be covered in the book is how to use a plumb line. A plumb line is a string that you hang from the ceiling with a weight at the bottom. That way it gives you a vertical frame of reference that you could use to measure posture. And then it's going to cover 4 different types of posture in the book. There's a lot more than 4 types, but in this book specifically, the 4 types of posture is going to be your ideal posture, your kyphosis, lordosis, the flat back posture, and the sway back. With regard to ideal, the external auditory meatus, the glenohumeral joint, the greater trochanter of the femur, the lateral condyle of the femur, the lateral malleolus of the ankle, they should be stacked up one on top of each other. With regard to kyphosis, lordosis, this is going to be hyperkyphosis and hyperlordosis. A lot of times this will be referred to as upper and lower cross syndrome. And what you're going to see is with the kyphosis, you're going to have this excessive curvature of the thoracic spine, and with the lordosis, or the hyperlordosis, you're going to have excessive curvature in the lumbar spine. Then with regard to flat back, what you're going to see is a flat lumbar spine, and typically the upper body is going to be projecting forward. And then with regard to sway back, it's the opposite. You're going to have the greater trochanter of the femur projecting forward, and then the thoracic spine is going to be moving backward. Then, aside from that, another one of the things that's going to be covered in this book is the different strength tests for the trunk, the lower extremity, and the upper extremity. There's going to be a lot of different tests for all of the different muscles in the body, but some of the really important ones that a lot of people have dysfunction with are going to be for the trunk, the back extensors. So these are going to be your erector spinae group, things like your iliocostalis, your longissimus, and your spinalis. Another thing is going to be the hip extensors, so your gluteus maximus, and also things like your transverse abdominis and your quadratus lumborum. Another thing with regard to the lower extremity that they're going to be covering, a lot of people have a lot of dysfunction with the hamstrings group. That is going to be the semimembranosus, the semitendinosus, and the biceps femoris, and things like the psoas and the gluteus maximus, gluteus minimus, and gluteus medius. Those are all going to be covered in this book. And then with regard to the upper extremity, a lot of people are going to have dysfunction in the rotator cuff muscles, so your supraspinatus, infraspinatus, teres minor, and subscapularis. Also your scapular retractors, so things like your rhomboids major and minor, and your pectoralis minor. And then one of the final things that's going to be covered in this book is going to be treating various conditions. I actually have a playlist called Be Your Own Therapist. There are 364 videos, so if you have any type of pain or postural dysfunction, you can check it out right up over here. But a few of the conditions that are going to be covered in this book are scoliosis, and then things regarding low back pain, shoulder pain, and also neck pain. So if you do have any type of postural dysfunction, or if you have a lot of pain, or if you treat patients with pain, or if you coach clients that have pain or postural dysfunction, I would highly encourage you to pick up this book. And then next Thursday at 2:00 p.m., I'm going to be reviewing a course that is going to be very complementary to this book, and that is going to be the Paul CHEK Exercise Coach course that is taught by the CHEK Institute. Great course. That's going to be next Thursday at 2:00 p.m., so check that out. If you guys have any questions, go ahead and ask your questions down in the comment section so I can help you guys out. But that's pretty much it for today's video. If you guys enjoyed the video, be sure to smash that like button so I know to keep making these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel, hit the notification bell, as I'm going to be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.